Hello, and welcome to SacMap Accessing Behavioral Health Resources in Sacramento County. I'm Savannah Mitchell, Program Coordinator for our SacMap program here at Cal Voices. So, a little bit about SacMap. SacMap is a program of Cal Voices funded by the Division of Behavioral Health Services through the voter-approved Proposition 63 Mental Health Service Act. The SacMap program seeks to decrease prolonged suffering by making the process of seeking, finding, and accessing behavioral health services understandable and accessible. Today, we'll learn about mental health and substance use recovery, Sacramento County Behavioral Health Services, SacMap and how to use the website, and a little bit about self-care. Part 1 is mental health and substance use recovery. First off, we want to provide you with some statistics about how common mental health challenges are. More than 50% of individuals will be diagnosed with a mental illness or disorder at some point in their lives. Now, that's over half the population, which is staggering. And it's also worth noting that this number includes people who are diagnosed with a mental illness or disorder. It doesn't include people who are just experiencing symptoms or that are undiagnosed. Also, 1 in 5 Americans will experience a mental illness in a given year. And 1 in 25 Americans live with a serious mental illness such as schizophrenia, bipolar disorder, or major depression. Now you can see how high these numbers are. They suggest that any person knows someone who has struggled with their mental health. They could be our neighbors, our friends, our families, or our coworkers. Just like with mental health, substance use challenges are common. More than 20 million people in the United States have a substance use disorder, and this is people who are diagnosed with a substance use disorder. Of course, the number of people who use substances is much higher, as illustrated in our next statistic. In 2021, among people aged 12 or older, 61.2 million people, which comes out to 21.9% of the population, used illicit drugs in the past year. Also, from 2021 data, we know that 94% of people aged 12 or older with the substance use disorder did not receive any treatment. So as common as the misuse or abuse of substances is, it's very uncommon for people to receive treatment. Alcohol use is also extremely common. Million individuals have alcohol use disorder, and less than 8% of them receive treatment. Again, it's clear that the vast majority of people who are struggling with substance use challenges are not getting treatment. For people with substance use disorders, there are numerous barriers to getting treatment, including lack of services being too costly to afford, and stigma. It can be hard to admit to abusing substances, especially when there's an assumption that abusing substances is sort of a character defect, something that is the person's own fault, not a legitimate diagnosable disorder, which studies have shown it to be. If people who are struggling with mental health and substance use challenges can receive treatment, there are some major benefits. Behavioral health services can help one manage their stress better. They can also help one reduce conflict and strengthen their relationships. It can help improve communication skills. Services may help you learn how to speak up for yourself more. And as someone who does receive services, you are the best advocate for yourself and for your needs. Another benefit is to develop coping skills. None of us know what life is going to throw at us, but we can be prepared to cope with some stressors or circumstances if we can learn and practice coping skills specific to those situations. Services can also help reduce isolation. For example, support groups or phone lines can improve connectiveness and help people who are struggling feel less alone. They can help build one's resiliency, and services can help someone work productively. There is a misconception that people who are dealing with mental health and substance use challenges are not capable of work. But studies show that working can help people gain and maintain recovery. Having a routine and feeling consistently productive is helpful. And finally, with the right treatment, even of us who feel too far gone to recover can gain hope for the future. Even if you are struggling with mental health and substance use challenges, you are not lost or beyond helping. Which brings us to the statement of fact. Recovery is real. Longitudinal studies, aka studies involving information gathered over time, demonstrate that most people who have struggled with a mental health challenge, even severe mental illness, can and do get better. For some people, symptoms diminish or disappear completely, even without medication. It's a common misconception that someone struggling with their mental health has to take medication to recover. In fact, people who don't take medication still do get better. While medication can be an integral part of someone's recovery, for another, taking medication may not be helpful. The important thing to realize is that there are lots of different treatments and services, and if medication isn't one of them for you, there are many more options. Recovery is also just as possible for people with substance use challenges. According to the latest U.S. National Survey on Drug Use and Health, more than 75% of people addicted to alcohol or drugs recover. Their condition improves, and substance use no longer dominates their life. So, what do we mean when we say someone has recovered? What constitutes recovery? Well, the Substance Abuse and Mental Health Service Administration developed a working definition of recovery back in 2012. According to them, recovery is a process of change through which an individual improves their health and wellness, lives a self-directed life, and strives to reach their full potential. Now, one of the things I like in this definition is the process of change piece. Recovery is not in fact a destination. It's not something you reach and then you never leave again. And it's also not something you can reach and then lose forever. It's an ongoing fluid process of change that is ever evolving. I'd also like to point out in this definition the phrase strive to reach their full potential. You notice how it doesn't specify what that potential is to be reached? Everyone is different. Their journey of recovery is different, and this is not a one-size-fits-all kind of mentality. So now we're going to move on to part 2, Sacramento County Behavioral Health Services. Sacramento County Behavioral Health provides a full array of culturally competent and linguistically proficient mental health and substance use services to individuals of all ages. So what do we mean by culturally competent? To be culturally competent, one must have the ability to effectively interact with people from cultures different from one's own, especially through a knowledge and appreciation of cultural differences. Sacramento County's culturally competent services include prevention and early intervention, outpatient services, case management services, crisis intervention and stabilization services, inpatient psychiatric hospitalizations, and substance use prevention and treatment services. I know it's a long list, but we're going to be breaking it down for you within the next slides. These are the types of services available that we are going to dig into today. Phone lines, wellness centers, respite services, outpatient services, crisis services, suicide prevention services, and substance use prevention and treatment services. And as we go through all of these services, we want you to keep all of them in the context of recovery. Recovery is highly personalized and may include different treatments, services, and supports, so we don't want to limit ourselves or others to a one-size-fits-all approach. We may find that one type of service works for us, or maybe a combination of services and supports will best meet our needs, but someone else going through recovery can have a total different list of services that work for them. Again, for each of these services available, we will provide you with some examples of organizations throughout Sacramento County. The first service we want to go over are phone resources. These behavioral health services and supports are accessible by phone, either by call or text. These services and supports offer immediate assistance, counseling, and connection to local resources. The great thing about phone resources is they can help you immediately. If you're in a crisis or not in a crisis, but just need someone to talk to in that moment, you can reach out. You can also reach out anonymously and get emotional support and often linkage to other resources. Here are a couple phone resources in Sac County. We have the Amalaya Youth Hope Line, which is a free and confidential peer counseling service for Muslim youth. They offer counseling by phone call or text. Also, Cal Voice's own SCC consumer-operated warm line. It's a non-crisis phone line anyone can call and receive supportive listening and referrals to mental health resources. As it says in the title, the warm line is consumer-operated, meaning that the people you speak to on the phone have lived experience with mental health challenges and recovery. The warm line also offers free groups called WRAP, which stand for Wellness Recovery Action Plan. In these groups, participants develop a wellness toolbox and crisis plan. Next up are wellness or drop-in centers, which are community-based multi-service centers that offer an array of comprehensive services and wellness activities designed to support clients in their recovery goals. Again, we have a couple examples for you. We have core wellness centers. Sacramento County has 11 core sites, which stands for Community Outreach Recovery and Empowerment Program. CORE provides specialty mental health outpatient services, and each core site has a wellness center, which is open to any Sacramento County adult seeking meaningful activities. Interested individuals can self-refer to a core program. Next, we have the Wind Youth Drop-In Center. It's a safe, non-judgmental space for homeless and runaway youth away from the dangers of the street. The drop-in center provides access to shelter, warm meals, showers, laundry services, employment assistance, educational assistance, case management services, and crisis intervention services. Next, we have respite services. A respite service is a safe environment in which participants increase their knowledge of available supports and how to access them, improve well-being, reduce stress, improve connectedness and reduce feelings of isolation, decrease risk of harm, and reduce visits to the emergency room in psychiatric hospitals. We have the ripple effect, which is a peer-run mental health respite service that provides a temporary safe space for individuals experiencing a mental health crisis but who are not in need of psychiatric hospitalization. The ripple effect offers peer counseling and resource referrals, and they are LGBTQ plus friendly, and services are available in both English and Spanish. We also have the Q Spot, which is a respite program administered by the Sacramento LGBT Community Center, and it provides drop-in mental health respite care and supportive services to underserved youth and transition-aged youth who identify as LGBTQ plus. Now we're going to talk about outpatient services and what are they. First off, we want to mention that in order to qualify for Sacramento County outpatient services, you must have Medi-Cal. Outpatient services are any service that don't require a person to stay overnight in a hospital or facility. Outpatient services include mental health treatment services, such as counseling and psychotherapy, which may help a person with mental illness develop coping skills for daily living. Medication support services include the prescribing, administering, and monitoring of psychiatric medicines. Medication management is completed by psychiatrists as well. Case management helps the patient with mental illness get medical, educational, social, vocational, rehabilitative, or other services when these services may be hard for that person to get access to on their own. Outpatient services also include work the provider does to help make services work better for the person receiving them. These include assessments to see if the patient needs the services and if the service is working, plan development to decide the goals of the person's treatment and the specific services that will be provided, as well as evaluations and monitoring of progress to see if the patient is meeting their treatment goals.
Outpatient services and how do they work? There are two different ways a person needing outpatient services can receive them. Anyone interested in services can reach out directly to the provider to determine their eligibility and make an appointment, assuming that the provider has availability. The second way is calling the Behavioral Health Service phone line. Since January 1st, 2025, all mental health and substance use treatment needs have been combined into one, behavioral health. So, how do they work? Well, if you want to get in touch with the behavioral health phone line, you can one, call the Behavioral Health Service and Screening and Coordination, BHS SAC, at 916-875-1055 for both adult and youth inquiries. Second, the staff will then have you attend a brief phone screening to determine the best program and level of care for you. And third, they will then assist you in finding a provider and getting the help you deserve. BHS SAC services that are offered are screening for substance use disorder and mental health issues, substance use disorder and mental health outpatient services, residential services, recovery residence and sober living environments, care coordination, crisis intervention, medication support, medication assisted treatment, prevention services, therapy, rehabilitation services and groups, DUI programs, and linkage to community resources.
Next, we have crisis services. Crisis services are services that provide behavioral health support for people with a mental health problem that can't wait for a regular scheduled appointment. So if you are in a crisis and need immediate help, there are services available for you. There is inpatient care, which opposed to outpatient care requires a patient to stay at a hospital or facility overnight. If an individual is in a severe episode, hospitalization may be needed to allow for an individual to be closely monitored to provide accurate diagnosis and to help adjust or stabilize medications. Inpatient services include mental health assessment, stabilization of acute symptoms, medication management, support groups, referrals, and discharge planning. Another example of crisis service is urgent care. In Sacramento County, we have a mental health Urgent Care Clinic, which is a walk-in clinic for individuals with an urgent mental health need. Services offered include counseling, crisis intervention, evaluations and assessment, peer and family support, referrals, and brief medication management. Also available are services we have already discussed, like respite care and phone support. Suicide prevention services are a variety of programs that provide culturally appropriate suicide prevention support. Suicide prevention includes suicide awareness, early prevention and intervention, and crisis management. Two examples of Sacramento County suicide prevention services are Friends for Survival. This program provides a free peer-led grief support group for family and/or friends dealing with struggles related to the death of a loved one by suicide. Their services include grief support groups, a monthly newsletter, resources, and community education. Next, we have the living room. The living room provides a calm and safe environment in which guests can resolve crisis without more intensive intervention. Services are offered at 2 locations across Sacramento, and these services include crisis intervention by telephone and/or in person, individual peer counseling, transportation, case management, and mental health and social service referrals and support groups. Now we want to take a closer look at suicide prevention. From 2011 to 2020, there were 2,008 suicide deaths in Sac County. That equates to over 220 deaths by suicide a year into 2020. And again, that's just within Sacramento County. The suicide prevention services we've discussed focus on promoting resiliency and reducing risk factors. There are many risk factors for suicide that vary from person to person, but some of the most common risk factors are previous suicide attempts. If someone has attempted suicide in the past, they are more likely than peers who haven't attempted to try again. History of depression or mental illness. Someone with a history of struggling with mental health challenges is more likely to attempt suicide. Alcohol or drug abuse. Someone who abuses substances may be at a greater risk for attempting suicide than peers who don't use. Physical illness. Someone who is suffering from a chronic illness, especially a chronic illness that causes a great deal of physical pain, is at a risk for suicide. Feelings of isolation. If someone is feeling isolated, lonely, cut off from others, and lacking human connection, they may be more likely to attempt suicide. And also hopelessness. Someone who is experiencing total despair or lack of hope is definitely at risk of attempting suicide. And while all of these risk factors pose a serious threat, conserved loved ones and providers often have the opportunity to intervene because many people contemplating suicide show warning signs. We want to give you some warning signs of suicide and things to be on the lookout for. This is from the National Institute of Mental Health. If a person is talking about wanting to die or being a burden to others, feeling hopeless, trapped, or sad, or displaying worrying behaviors like withdrawing from friends, making a will, taking risks, having extreme mood swings, giving away personal possessions, they may be thinking about suicide. This graphic also includes the 988 Suicide and Crisis Lifeline. 988 is a new number for suicide prevention hotline. You can call or text them or chat with them online, and they are available 24/7. Substance use prevention and treatment services. There are a variety of services specific to the prevention and treatment of substance use. Prevention services are programs directed at individuals who are at risk of developing a substance use disorder but don't require treatment for one yet. Outpatient services include intake and assessment, treatment planning, counseling, education, medication services, crisis intervention services, and discharge planning. Intensive outpatient services include the same components as outpatient services with an increased number of service hours. Medication-assisted treatment includes the prescribing, administering, and monitoring of all medications for substance use disorders. Withdrawal management services include intake and assessment, monitoring to evaluate individuals during the detoxification process, medication services, and discharge planning. Residential treatment is a non-institutional and non-medical 24-hour short-term living support that provides rehabilitation services to individuals with a substance use disorder. Collaborative courts combine judicial supervision with rehabilitation services that are rigorously monitored and focus on the recovery to reduce recidivism and improve offender outcomes. These programs provide offenders with services such as alcohol and/or drug treatment rather than jail time. Now we want to take a little time to look at substance use prevention more closely. Substance use disorders can co-occur with a mental health disorder. Though this is certainly not always the case, some people do suffer from both. And just like with suicide, there are risk factors for substance use disorder. Again, these vary by person, but these are just some common risk factors. Family or peers who use. If a person knows others who use substances, they're more likely to use substances themselves. Adverse childhood experiences, or ACEs. These are potentially traumatic events that happen between age 18 that can have lasting impacts on an individual's health. ACEs also include violence, abuse, or growing up in a family with mental health or substance use problems. Someone who has experienced ACEs is at risk of using substances in adulthood. Genetic predisposition to addiction. There is evidence that shows as much as 50% of a person's likelihood to become addicted to a substance is genetically predisposed. What this means is that the genes play a key role in addiction, but they do not play the only role in determining whether or not a person will become addicted to substances. So there can be a genetic component to addiction depending on the individual. Neighborhood poverty and violence. Studies show that living in a neighborhood that is improvised and has violent events is a risk factor for substance use. Easy access to substances. If you can get substance easily, you're more likely to use them. And this ties in with norms and laws favorable to substance use. If substance use is sort of expected in a population or community, and if there are not harsh laws to de-insensitize people from using substances, substances are more likely to be abused. There are on average over 70,000 drug overdose deaths in the United States per year. For some years, that number is higher. In 2021, for example, were around 100,000. And the biggest killer involved in overdoses is an opioid. For those of you unfamiliar, an opioid is a controlled substance that can be administered by a licensed prescriber. Opioids are powerful and used legally for pain management, but are meant to be used for a short term only. The term opioid includes synthetic opioids, those grown in a lab. From 2012 to 2015, the US saw a 264% increase in synthetic opioid deaths. The graph we've included here shows drug overdose trends from 1999 to 2021. The purple line represents deaths by synthetic opioids, and you can just see how the number has skyrocketed. Now we want to look a little more closely at the most common and deadliest of synthetic opioids, fentanyl. As mentioned in the previous slide, fentanyl and other synthetic opioids are the most common drugs involved in overdose deaths. As you can see here, in data from the Centers for Disease Control in 2021, over 75% of drug overdose deaths involved an opioid. Fentanyl, in its legal form, is used to treat short-term pain. Illegal fentanyl is mixed with other drugs because it's cheap to add and it increases the drug's potency. Fentanyl is similar to morphine but up to 100 times more potent. Overdose deaths by fentanyl are on the rise and are a serious threat to communities, including our own Sacramento County. In fact, more people are dying from fentanyl-related deaths than firearm-related homicides in Sac County. The majority of fentanyl-related deaths are youth as well. In 2020, 64% of fentanyl-related deaths in Sac County were in the 15 to 29-year-old age group. When fentanyl has been mixed in with another drug, it can't be seen, tasted, or smelled. Without testing the substance being used, it's nearly impossible to know if it contains fentanyl. When a person using drugs is unaware that fentanyl is present, they can underestimate the amount of opioids they are taking, resulting in an overdose. And when it comes to fentanyl, a lethal dose of fentanyl is just 0.002 grams. And to put that into context, next to this penny is that lethal amount of fentanyl. It's good to be aware of what an overdose looks like in case you are able to help. Someone who is overdosing may show some of these signs, like blue lips or nails, choking or snoring sounds, dizziness and confusion, they can't be woken up, slow or no breathing, difficulty staying awake. If you suspect an overdose, always immediately call 911. 911 operators can give you instructions on what to do for the person overdosing. If you have Narcan available, you have the option of using it. Stay on the phone with 911 and keep following their directions. So, what is Narcan? Narcan, also known as naloxone, is a life-saving medication. It's a nasal spray that reverses an opioid overdose while having little to no effect on an individual if opioids aren't present in their system. So Narcan can reverse an opioid overdose if it's happening, but if it's not happening, it won't harm the person who doesn't have opioids in their system. The California Department of Healthcare Services provides free naloxone to organizations and entities eligible to administer or distribute it through a California Public Health Standing Order. If you are interested in getting Narcan, there are several places in Sacramento County that are approved to distribute it, which we will also be going over in our next slide as well. Finally, it's important to note that a person giving or administering Narcan is protected by law under the Good Samaritan Act. The Good Samaritan Act is a law that protects civilians who help people they believe to be injured or in danger. It helps provide people with the freedom to act without having to fear they're going to get sued. So let's say you elect to use Narcan on an individual who you suspect of overdosing, but they're not overdosing and they're upset that Narcan was used on them. They can't sue you for it. As mentioned in the previous slide, Narcan is a nasal spray. We have a picture here on the slide to show you what it looks like. And there are several places in Sacramento County that distribute it. These organizations also provide fentanyl test strips, which can be used to test drugs for the presence of fentanyl in order to know what to avoid. Narcan and fentanyl test strips are available at these Sacramento County harm reduction organizations: Harm Reduction Services, Safe Alternatives Through Networking and Education, Sacramento LGBT Center, Ginger Health Center, and Sunburst Projects. Next, we're going to show you how to use the SacMap webpage. This is our SacMap webpage. This is what our website looks like. You can find it by going to www.calvoices.org/SacMap. When you get to the website, you will then press on Programs and SacMap, and this page will pop up for you. When you scroll down, you'll be able to see that all services are organized. We have crisis services, children, youth, and young adults, older adults, diverse communities, substance use treatment and prevention services, and behavioral health information and advocacy. Just for example, I'll go to children, youth, and young adults. You press on it, and it tells you a little bit more about SacMap and about children, youth, and young adults behavioral health resources in Sacramento County. It goes down here and it tells you all the different kinds of services available in this section: counseling services, homeless services, suicide prevention, wellness centers, parent support, county services, crisis services, diverse communities, respite programs, phone support, and substance use, as well as more resources for 18 plus. So for example, let's say I want to go to wellness centers. I can type on wellness centers and it will take me all the way down so I don't have to scroll down and look for it. It'll take me to exactly what I'm looking for. Then you'll be able to see all of the wellness centers that pop up. Again, SacMap focuses primarily on free and low-cost resources within Sacramento County so that people who are looking for support have access to them as they are available at a free or low cost or sliding scale rate with insurance. For example, when you find a program that you're interested in, it'll have the name, which you can also tap on, and it'll take you to their website. You have their address, their phone number, their hours of operation. You have their program description, so a little bit about the program, the services that they offer, the eligibility to be able to access that service, the cost, and the referral process. So let's say I'm done looking at wellness and drop-in centers. I can find a back to top button, and it'll take me right back to the top so that I can scroll back down and continue to look at these services. So maybe I want to go to suicide prevention. Again, it'll take me all the way back down, and for each section, it'll have their program description, services, eligibility, cost, resource referrals, as well as their address, their phone number, and their hours of operation. And as well, you can always tap on the name to get access to their website. So again, I don't have to scroll up, but if I want to scroll up, you can find every service available as well. We have phone support where it doesn't have all as detailed information as the other ones, but it gives you the call number, it gives you their hours of operation, and a little bit about the program. Again, I can just find it back to top, and it'll take me right back to the top where I can go back and say I want to look at a different service. Maybe I want to look at substance use treatment and prevention services. It tells us how to access substance use services, what to do in an overdose emergency, and then it comes up with all of our selections. Adult, 18 plus, phone support, DUI programs, safe medication disposal, support groups, youth under age 18, parenting and pregnant women, and coalitions. Let's say I want to get more information on DUI programs. Again, it'll take me all the way down so I don't have to scroll and look for that information. It'll tell you the addresses and the phone numbers or how to contact these different organizations so that you can find driving under the influence DUI programs to help support you. And again, we focus primarily on free and low cost services so that everybody can access services. That is our main goal here at SacMap. I always suggest that people take about 30 minutes to just go through all of our different tabs and look at all the different services so you can best support yourself, your clients, your family, your neighbors, and anyone that could need help. Again, now we're on crisis resources, so maybe I want to look at inpatient services. It'll take me to inpatient services in a little bit, and it tells us a little bit about inpatient services. I can scroll down and find additional crisis support, and then I can go back to the top. And we're always updating and changing our SacMap to make sure that we stay on top of resources and programs changing their information. We always suggest that if you find something that isn't updated or a link's not working or a phone number's changed, please email us at sacmap@calvoices.org and we will get on it to fix that right away for you. We rely on the support of our community members to make sure that we stay on top of all of the resource changes in SacMap because it's hard to stay on top of it all by ourselves. So that's a little bit about our website and how it works. Alrighty, now we'll get back to our slides. So part 3 was the SacMap webpage, and now we're going to dive into part 4, self-care. So what does self-care really mean? Self-care means taking the time to do things that help you live well and improve both your physical health and mental health. Self-care has a big positive impact on your mental health. When it comes to your mental health, self-care can help you manage stress, lower your risk of illness, and increase your energy. Now, another point is in self-care that should be known is that self-care is important. It's also equally important to know when to ask for help. I want to remind everyone that it's okay to not be okay, and it's okay to reach out for help. Let's all make sure we prioritize ourselves in our self-care to better our overall health. So we talked in the last slide about how self-care is good for our mental and physical health. There is a lot of different types of ways to go about self-care. So we have 8 different examples for you up on the slide. We have physical, sleep, eating healthy foods, exercise, emotional self-care, stress management, compassion, resiliency, social, boundaries, a good support system and connection, spiritual, time alone, meditation, working on your religion practice, personal, hobbies or fun activities you like to do, and being true to yourself, space, security, a healthy living environment, and safety, feeling safe in your environment, financial, saving or splurging, or money management, work, positive workplace, learning, and taking breaks. So that was a little bit about self-care and a little bit about SacMap and our community here in Sacramento County when it comes to mental health and substance use prevention. If anyone is interested in talking more with us about SacMap, please contact us from any of these available contacts. We have our website, which is http://www.calvoices.org/SacMap. Our email is sacmap@calvoices.org. Our phone is 916-855-5444. And our social media is, well, our Facebook is /CalVoices. Our X handle is @CalVoices, and our Instagram is @Cal_Voices. Thank you for learning about SacMap accessing behavioral health services with us, and I hope you all have a great day.